Delta, which is quickly becoming the dominant strain in many countries, we're in a very dangerous period of this pandemic. Many small island developing states have succeeded in preventing widespread transmission of COVID-19 in their communities. But the pandemic has hit you hard in other ways, such as declining revenues from tourism, which is affecting your economy significantly, compounded by more transmissible variants like Delta, which is quickly becoming the dominant strain in many countries. We're in a very dangerous period of this pandemic. In those countries with low vaccination coverage, terrible scenes of hospitals overflowing are again becoming the norm. But no country on earth is out of the woods yet. The Delta variant is dangerous and is continuing to evolve and mutate, which requires constant evaluation and careful adjustment of the public health response. Delta has been detected in at least 98 countries and is spreading quickly in countries with low and high vaccination coverage. There are essentially two ways for countries to push back against new surges: public health and social measures like strong surveillance, strategic testing, early case detection, isolation, and clinical care remain critical, as well as masking, physical distance, avoiding crowded places, and keeping indoor areas well ventilated are the basis for the response. And second, the world must equitably share protective gear, oxygen, tests, treatments, and vaccines. I have urged leaders across the world to work together to ensure that by this time next year, 70% of all people in every country are vaccinated. This is the best way to slow the pandemic, save lives, drive a truly global economic recovery, and along the way, prevent further dangerous variants from getting the upper hand. By the end of this September, we're calling on leaders to vaccinate at least 10% of people in all countries. This would protect health workers and those at most risk, effectively ending the acute stage of the pandemic and saving a lot of lives. It's a challenge, but we know it's possible because already 3 billion vaccines have been distributed. It is within the collective power of a few countries to step up and ensure that vaccines are shared, manufacturing is increased, and that the funds are in place to purchase the tools needed.